to welcome all of you here. I have somebody very special. You all know him, Dr. Howard Farran. We won't tell everybody, Howard, what we said about your initials after your name. I know you're open to that idea, but it was something like a DMD degree, but not quite, right?
Right.
So look, excited to have him here. He's going to be talking at the live summit, virtual summit, September 18th at 8 a.m. Pacific time. So you all have to pay attention to that. And I want to just bring him on today a little bit and talk to him a little bit about today's dentist. And I told him before we started, I just had a couple of minutes with him. I said, look, Howard, you interview everybody. It's my turn to interview you. So he promised he's not going to ask me questions today, right, Howard?
Right. I'm in this. I'm taking the witness stand today.
All right.
I'm OJ taking the witness stand.
All right. Well, listen. Tell me what your thoughts are about this period of time right now for the young dentist. I know you have a lot of young followers. So what is the big topic for you that you're trying to help young dentists with today?
So in the grand scheme of their career, I mean, you know, when you come out of school at 25, like I'm here in Phoenix, so we have two dental schools, right? AT Still and Mesa, Midwestern and Glendale. So when they're, you know, I turned 58 Saturday. Well, when they're 58, they might not even remember this time. I mean, it's such a little blip. It's a little hiccup. Remember the same thing when Kimberly Bergalis was all over the news. It was a blonde girl from University of Gainesville, and she caught AIDS at the dental office, and same thing, but it all blows away. AIDS, you know, this is my second rodeo of the virus. The AIDS made all the old guys wear gloves and custom, you know, all this stuff. And that prepared us for this, and this one's making us stronger. This thing's going to be, you know, worst case scenario, this thing's going to be gone sometime between Christmas and next Christmas, right? I mean, I'm out here in Arizona. The deaths are just trending down rapidly. I mean, they're just plummeting, and nobody can predict the future. So any expert that tells you what's going to happen, well, tell him to apply his knowledge to the stock market or something more useful, because nobody can predict the future because it doesn't exist. It hasn't happened yet. So nobody knows, but I will tell you that all the same stuff is going to apply. You know, the people that live in fear, that want to go be someone else's employee, that don't want to be an owner-operator, that don't want to start the American dream and have faith in themselves. I mean, I graduated May 11, and I was open September 21. And I know a gazillion kids that they just think about it for 5 years. And if you're on such a great idea plan, like if you really think working for Aspen is the best idea, then why did you quit after a year? Then you quit. I mean, you meet them 5 years out of school, they've had 5 different jobs. And I'm telling you, I know my dentist, you can't go to school 8 years and agree with anyone else. I mean, you couldn't even get 2 dentists to agree that today is Wednesday. You know, if we were both sitting at a dental convention. I mean, dentists like everything their own way. They don't get along well with others. In fact, professionally, they eat each other. So just have faith in yourself. I mean, dentistry is not going away. Go open up your own practice. And it's the same advice I give for kids too. Like a lot of people are thinking, well, you know, it's not the perfect time to open a practice, or that's not the perfect time to have a kid. Look, family first, business second, right? The best time, when I got married, I made 4 boys in 60 months. I mean, I knew there was no good time to make a litter of kids. I mean, there's no good time. So you know what the best time is? Now, and get it out of the way. And it was right when I opened my practice. I opened a practice and made 4 baby monkeys without a tail in 60 months. It was chaos for 5 to 10 years. But when I finally you know, could relax, I was so glad because it was behind me. But what are they doing now? They're taking those 5 to 10 years and thinking about the perfect time to have 1 kid, 2 kids, 3 kids, the perfect time to open up. Dude, there's no perfect time. You're too risk adverse. Dive in the deep end head first with your babies and your practice. You're not going to drown. And the quicker it's over, remember that song, take a spoonful of sugar, make the medicine go down. Just take that shot, you know, slam it, knock out your kid, knock out your practice, just go for it. Quit living in fear and waiting for the perfect time.
Well, I think fear factor is a big part of any kind of movement and any kind of decision-making process. But to add to that, do you think they should buy the building, buy an office condo as well? Or do you think they should, I had this discussion with a young orthodontist just a couple of days ago, where he gets $850,000 for the practice, and the dentist owner of the building wants 1.1 million for the building. So, you know, he just bought a $1.6 million house, and he's going to put another 500K into. So he's 2.3 there. He's about 600 in debt in school. And now it's another 2 million for the building and the practice. What's your thoughts on that?
Well, I mean, I live across the street from the Guadalupe Indian Reservation. So for 30 years, when my patient Ricky comes over to my practice, or many patients, I walk out there and he wants to show me his fancy car. And I'm like, that fancy car could have been a degree at De Novo to get you a good job with dental benefits. I said, when those good looking girls over there in Guadalupe, when they talk about friends with benefits, they're talking about dental benefits, not some good looking guy in a lowrider. And so the first thing I want to say about that dentist is you already told me, you already confessed that he bought a big house and he's a renter. So he's a peasant. He's a highly trained peasant dentist. You don't, you know, when you buy land and building for business that spends off cash flow, that's a business. But when you go into that type of debt for consumption, that's the curse of dentists. And these dentists, lawyers, physicians, I mean, I'm even seeing now, I turned 58 Saturday. I have friends my age that just upgraded to the next level house in Scottsdale on a 30-year loan. I'm like, or did I miss something? You're damn near 60 and you just bought twice as much house on a 30-year loan. So so I want to answer your question succinctly. The main thing is the business. I used to have this argument with Dan Carney, the founder of Pizza, Dan Carney, his brother Frank, Dan's wife Beverly, and he always said, I'm in the pizza business. He says, the only reason I buy the land and building is if I have to get the best location on the current corner of First Street in Maine. But if I can go to that, get that location rent, he goes, I'm not a real estate agent. I've had Grant Cardone on the show twice, and he'll tell you the obvious thing that you need a staff to make money on the real estate business, just like a dental office. There's no, you can't name any dentist one. And to get that critical max, you're going to need about 16 properties. So if you're going to get in the real estate business, he recommends that the first thing you do is buy a 12-plex or a 16-plex duplex and live in there. Like if your buddy, instead of buying that $1.2 million home and dump 500,000 into it, if he would have bought a 12-unit duplex and he just humbly moved into that little deal and rented out the other 11, he could have started a real estate business while he started a dental business. So to be succinct, you're in the dental business and that's where you're going to make the most money. If you're going to make money in real estate, that's just like learning how to do a root canal. That is, you're going to compete. You're out there in San Diego, right?
Yes.
You're a suburb of San Diego, or are you in San Diego?
Suburb.
Yeah, but I mean, some of the smartest people on earth are in the real estate business in San Diego. So you're not going to compete with that guy on the side, just like your real estate guy isn't going to walk into your office and say, let me show you how a root canal is done, and jump in the chair and do a root canal. So root canals, very serious competition. Real estate in California, my God, that might be, I mean, California real estate, that's more brutal than anything I can think of in Central and South America or Africa or half of Asia. So so again, to really make money in the real estate business, well, you're going to need a staff. You're going to need a headquarters. You're going to need at least one person, and you're going to have one person to collect the rent, fix the sink, light bulbs. And so
let me ask you this. You talk about, you know, residential real estate, right? As far as investing in real estate. Let's say what advice you would give the dentist to invest in if it's not buying their own building and they don't want to get into real estate, as what you're suggesting sounds to be, you know, a little bit more complicated in a sense, as far as focusing on staying in the dental business. You know, one of the things I talk a lot about is I say, look, if you got $100,000 or $200,000 sitting, go get continuing education. Don't invest that money. Continue your training, because if you can do cosmetics and if you can do dental implants, pick 2 or 3 things that really allow you to be different, and then just run after that and become the best at that. The problem is we pick all of the services and we're just mediocre at each one of them, right? So if you're telling me that investing in real estate is not wise, would you say invest in continuing education? Where do you think, what are the top 2 or 3 areas that you think a dentist should invest in if it's not, in an office building?
Well, let's just talk about investing in general. And I have to confess that you're a product of your environment. I grew up in Wichita, and I went to Creighton University, 1980. Warren Buffett, Oracle Omaha. I came over and talked to her class. Been on that bandwagon ever since. What is your protective moat around that business? Why do companies get a patent? Why do they get a copyright? Why do they have you got to have a protective moat around that product. Sometimes it's price. When you're the low cost leader, that's the most indefensible. When you're Southwest Airlines, Sam's Club, Price Club, Costco, those are good protective moats. But look at the protective moat around dentistry. In 1900, you set up all these state boards that said that we're going to be the judge, jury, and the executioner. And they closed down 90% of the schools. Like today, if someone, America makes mediocre to shitty products. I mean, look at Bill Gates out there telling everybody knows about viruses. Microsoft is the shittiest software I've ever used in my life. It's filled with viruses. That's America. America is not a Germany. I've been to Germany and Tokyo where they make Mercedes and Lexus, and those civilizations are scale more advanced than in America. But when that German dentist comes to America, do we accept his dental license from Germany, which is infinitely better? I mean, they're lab technicians. Our dental schools closed down all the labs, and the dental schools in Germany, you can become a doctor of dental laboratory. So, yeah. And you know the lab business as well as anybody. Yeah. So the bottom line is they can't come here because there's a protective moat. So you have this union of state boards that won't let anybody in think how many dentists in Mexico, down in Tijuana, that would come up to San Diego tomorrow and do fillings for $5 if it was legal. But you have this union. So since you have this business, the real estate business, you're competing with people that come from all over the world. Anybody can open a dry cleaner. Anybody can get into real estate. I think anybody can own a taxi or a 7-Eleven. But my God, a dental license to do this. So you're already in such a protective moat. And I'm not saying it's right or wrong. The whole thing's a scam. It's a complete scam for the consumer. But we're not the consumer. We're not the patient. We're the doctor. So when I'm looking at real estate with no protective moats or barriers around it, I'm looking at the guy's a dentist and he wants to get in the real estate business. Does he have a head injury? So dentistry, I mean, my God, dentistry, healthcare. In fact, to show you how good the government screwed it up by unionizing with the doctors, now their consumers are begging now the government to help them pay for health care. So, and that's always the case. The government creates the problem, and it's so bad that the people go and beg the guy who created the problem to fix it for them. They can never go back 2 steps and say, let's just unravel your last great idea and deregulate healthcare. That's not going to happen. So yeah, healthcare, I think, the 20 richest countries, they all have socialized medicine. We have in the United States, we have Medicare for everybody over 65. They all love it. You got Medicaid for poor. It's kind of scrambled, but everybody around the world has drunk the purple Kool-Aid that the government can regulate it. So it's so messed up and so expensive that they'll pay for it. And then, so I would stay in that business as a dentist. And that's what's great about dentists is dentists got separated all the way back to the first dental school in University of Baltimore. That was the first dental university. The first dental school was in Ohio. And we needed a chair that sat up, and the doctors needed a bed that laid down. And that was simply where the paths cross. Sure. But in 1963, the physicians got in bed with John F. Kennedy's Medicare, and then Lyndon B. Johnson signed the law. So they went off the cliff with the government. We're the least regulated. So we're tied to this union government mob scan, but we're the least regulated of them all. So dentistry would be where I would put your investment in, and then I would always start stealing from the Fortune 500 companies the ideas. I mean, they've proven you it worked, and one-stop shop is what made retail. That's what made Amazon. They called it Amazon because it started out with books, but they want to sell everything. So right now, when I go to a dentist in San Diego, you're going to say, "Oh, you need a root canal. You need to go over here. Oh, you need an implant. Go over there. Oh, you need ortho." Look at the fastest growing business models, the pediatric dentist. Well, if you take 100 kids in there, how many of their moms are going to say, "Does my baby need ortho someday?" Yeah, and then you give them a referral card and send them down the street. The fastest growing one is adding pediatric dentists plus ortho. Boom, those are that's 1 + 1 = 3 as opposed to just 1 + 1. Look at Clear Choice. They took the oral surgeon and the prosthodontist and the lab, and my God, I mean, that's a gazillion-dollar business.
Right now, a GP and a periodontist is a great setup. If you can get a GP and a periodontist together, in my opinion, I think that could be a very valuable dental practice. Now, a lot of doctors are also, like you said, are bringing their own lab into their place of business to save, quote unquote, on the lab cost, right? And kind of control their lab. But ultimately, I think what you're saying is stay in dentistry, expand one of the things I do right now is I bring an endodontist, a periodontist, and an oral surgeon into my practice so I don't refer out, right? So I focus on my ortho and cosmetics, and then, some quadrant dentistry, I bring some GPs in to do that. And I do the exams because dentists don't know how to do exams very well, which I think, look, here's a fact that I believe in strongly. I think every day we have so many missed opportunities. If dentists realize how much production they're leaving on the table every single day from things that they don't see and things they're too afraid to treatment plan, or they fear that something is going to go wrong within their system, I think there's a lot of opportunity there. But to your point, I think if a doctor can treatment plan better as a doctor of the oral cavity and not a mechanic of teeth or the technicality of just working on teeth, and also bringing in more services within the practice to be able to keep everything in-house and stop the referral sources, and specialists necessarily don't like me to say that. And then on top of that, potentially continue, look, why do dentists work 3-4 days a week? Why not work the 5th and 6th day? Why not bring in a GP to be open that 5th, 6th, and 7th day that you're closed on? So I strongly believe that doctors go into wanting to open up a second office or a third office when they're working 4 days a week as is in their place of business with 2 chairs not being utilized. So expand and grow your place of business first. Do all of the things that you're suggesting and I'm bringing up here, and you will see that will add tremendous value to your place of business before you have to look elsewhere. What do you think about that, Howard?
Oh my God!
You think I'm crazy?
Well, crazy is good. You know why I love.
I know you're crazy. I mean, look at the things you're talking about today.
But you know why I love being called crazy. It's my favorite adjective for me, because if you say, "Well, Howard's crazy," well, then okay, great, he's crazy. But now answer the question. It's not about Howard. These are questions for you, and it's a straw man argument saying, "Well, he's bold." Well, what does crazy and bold have to do with anything? Answer the question. And so I want to unravel or go through some of the genius things you said. The DSOs are figuring this out, that, they would let these kids come out of school. They do a bunch of molar endo. Then they hop jobs every year. And then over the next 5 years, they got to pay for 10 or 15% of these to be retreated. Well, you retreat 10% of your root canals with the profit dollars out of the other 90, and you already had 65% overhead. So now the DSO is already looking at there's no money in a general dentist doing molar endo. The general dentist for the whole country have a 10% 5-year extraction rate, and the endodontists have a 5%. Same thing with implants. Oh my God, implants, if you do 4 cases and one of them failed and you got a warranty redo it for free, it costs the profits of the first 3 to redo this one. So there's no money made in implants unless you have a periodontist place them. So you got a kid out of school that just went to the Holiday Inn and learned how to place implants. And over here, I got a periodontist. So yeah, bringing in the rotating 12 specialties, oral surgery, I'd rather have the periodontist placing the implants, and I'd rather have the endodontist doing all the molar endos. The patient doesn't want to go anywhere else. It's one-stop shop. The general dentists are good. The first 4 years, they can do simple endo, anterior fillings, cleaning exams. But what you said that was the most mind-blowing is goes all the way back to Dr. Mort Copenhaver. When I got here in '87, Dr. Mort Copenhaver was the first DSO kingpin out here, and he did exactly what you said. In fact, one of his employees was Jack Dillenberg, who was the dean of AT Still, and when he had 5 dentists, all the young ones would go be mechanics. The youngest would do the simple 1-2 dentistry. 3 or 4 years, you could move up to quadrant. It might take 5 or 10 to get to full mouth. But the guy that was like you or me, well, he wasn't going to have them be a mechanic. He did all the exams. He did all the new patient exams, the recall exams, because the hardest skill you're ever going to learn is to learn how to play in the sandbox with the other kids in the neighborhood. And humans are complex. They're finicky. I used to just be amazed at how I had really good friends in Phoenix that had kids the same age. And you just look at these kids, like both dad's a dentist, both live in the same neighborhood. These kids are going to love each other. But sure enough, they didn't like one or one didn't like another. Humans are complicated. So the number one skill you're going to get is presenting treatment. And I've seen some where a young kid out of school overbuys a practice. They'll buy a big dog practice from a guy like you who can sell these big cases, and he's looking at that revenue, but he doesn't realize he doesn't have any idea he can't sell those cases. Yeah. So learning your people skills, patient presentation, Yeah,
and you know what, Howard, I think this is important to state as well. When you bring a specialist, you got to be out of network with your specialist. And I know insurance discussions come up, and I am in network, but my specialists are out of network. That's really important to understand. But Delta is pretty good in California for specialists. So typically with Delta, they're fairly close to their cash fees of the specialist. So keep that in mind. With that said, here's the important part. If you don't know how to do an exam, and if you don't know how to get a patient to say yes to you, nothing happens in your place of business, period. You can do all of your training, and you know this, Howard, you can do all of your training, bring all the team, have the best equipment, all this, bells and whistles. If the patient doesn't say yes to you, nothing happens. And the difficulty for young dentists, and I think the struggle is that they don't have the training to really be able to explain treatment plan and even perform bigger case dentistry. And with that said, a lot of times an older guy that's 50, 60 years old might have a hard time writing you a check for $50,000, $60,000. So you have to spend that initial part. And I go back to that continuing education. If you do have some money and you're young in your career in the first 5 years, and I know you have a young audience, invest in your continuing education. It's the best place you can invest into, so you can prepare yourself and put yourself in a position year 6, 7, 8, that you can now catapult your production skills. I think that's really important to understand for the young dentist. You get a lot of interaction with the young ones. What's their biggest complaint?
Well, I'm trying to find this list I had here. I think I might be coming up on it, maybe not. But I mean, when I got out of school, there were 9 specialties. Oh, here it is. So right now we're looking at out of nowhere. I mean, there's 12 specialties: oral surgery, endo. These are from most demand. So when you said something earlier, dentists, they don't get along with their value chain. Like you go to McDonald's, they love their meat man, they love their grocer, the whole value chain, like at Intel, the whole value chain that makes all the components for that chip. It's like a big, huge interactive fraternity. But we have dentists who are worried that the endodontist doesn't want us taking his referrals, and the orthodontist doesn't want his Invisalign, and we don't like Delta because they just won't pay whatever we say. And our whole value chain fights when it's only the customer. It's one eye on the patient and one eye on cost. And as technology goes up, but here's the most in demand to come into your office: oral surgery 1, endo 2, perio, pediatric dentistry, orthodontics, prosthodontics, dental anesthesia, oral facial pain, oral medicine, oral path, oral radiology. And the bottom line is, when you own a dental office, you know, it used to be maybe in 1970 that you could come out of school and go to the Pankey Institute and learn everything about dentistry from A to Z. You don't have a snowball's chance in hell of being able to be top notch in 12 different specialties. In fact, even when you go into oral surgery's office, I mean, you see this all the time in a group practice oral surgery, only one guy's doing the orthodontic because he wants to do all the orthodontic, so he reaches critical mass. And then the oldest guy is like, you know what, I'm old, I just want to do the wisdom teeth. And then the young whippersnapper in the middle is doing all the implants. So to sit there and be Dr. Do-It-All is going to be Dr. Do-Little. I mean, it just doesn't work. The customer comes first, and, you know, treat other people like you want to be treated. I'd rather have an endodontist do my molar than some kid that just graduated an hour ago. So I would just keep one eye on the patient. And then I would say, this patient who was named a patient because he was asked to be patient while waiting in this room because we're running behind because we don't have our shit together and we have horrible business skills. Well, that patient should not have to be patient. They should have to wait in a waiting room. Now the waiting room's infected and it's moved to the car. I would start working on the retail aspects of the business. I would start rotating specialists through. I met an endodontist the other day, came out of school with 400,000 undergrad, 300,000 endo school, and he wants to buy this $1.5 million practice in Phoenix. Like, dude, every office in town could line up your molars. It'd be like shooting fish in a barrel, but they're animals. So they want to go pee on all four corners and mark their territory. And this is mine, and beat their chests, and quit being a sapien and try to be a human businessman.
Look, business efficiency is huge. Doctors are not busy. They dink around too much and they're completely inefficient. Here's a classic example. If it takes you an hour and a half to 2 hours to extract 4 wisdom teeth for $800, you can get a specialist in there at a network to do it for you in 45 minutes for $2,500, and you give them 50%. Or $3,000 and you give them 50%. And you don't touch the patient, you double your money, and you got an extra hour and a half to 2 hours of time to focus on something else. Look, the reality is this. Look, the fact is this. Why can a doctor do $500,000 and another doctor do $5 or $6 million in the same time period of 12 months? Because they're efficient with their time. They know how to maximize their skill set. I talked to Dr. David Hornbrook, and he said, look, for 25 years, all I've done, I had him on Facebook Live. For 25 years, I've focused on cosmetic dentistry, and that's it. That's what I focus on. That's my specialty, and I'm damn good at it. And so my point that I mentioned to you at the beginning is pick 1 or 2 services and be great at it and be efficient. Look, I can cut 10 teeth in an hour. I can cut 10 teeth in an hour and a half that's got a lot of decay on it. So the point is, if I'm doing that at $1,000, $1,200, $1,500, that's $8,000 to $15,000, $10,000 to $15,000 in that hour and a half of production. The same time that doctor took to do 4 wisdom teeth in that hour and a half for $800. That's where you have to understand the efficiency of time. And every dentist can do this. It's not that I've done this for 20 years. Dentists can do this 8, 9, 10 years out, or maybe sooner.
Well, let's talk about the efficiency of telling me lies. Is what the dentist will say is, I think a single unit crown on a 6-year molar, you only need 30 minutes. I mean, you go there and you numb with Septicane, you set a timer. While the timer's setting, you pack the 0 and the 1, you take the shade, you take the lab script. If it's an old man, it's an A35. You don't get out a shade guide if they're over 65. And as soon as the timer goes ding, a 57 takes out the interproximals, you get your reduction. And then when it's all prepped, your cord's packed, so the gum's down and out. Then you make your temporary. You learn anybody that gets a reduction coping took an impression or scanned it before they made the temporary. And then you make the temporary, you work out, I didn't have enough reduction. Well, you get all done. And then when you're done, you scan or impress, and you're done in 30 minutes. But what do the other dentists all in the same office say, oh, well, you know why Wendy's has square hamburger patties because they don't cut any corners, and he's rushing and he in quality, so they always blame it. But what do? They numb up and then they go back to their office and get on Facebook for 10 or 15 minutes, and then they put on new PPE, and then they go numb, and then they'll say, well, I'll have the assistant pack cord. So they'll leave the room for 15 minutes for the assistant to pack cord. I can pack a 0 and a 1 in 1 minute every freaking time. So what you're dealing with is a bunch of lazy liars. Dr. Lazy Liar, because when I go into a dental office, and in 32 years, I've cold walked into 1,000 offices, because when I'm walking around Manhattan or Jamaica or Kathmandu and I see a dental office, I go right in there. When I cold just walk into a dental office, where is the dentist 80% of the time when I walk in there?
Not in the dental chair. But
he's always in the back room. I mean, they're never working. Just like if you were an alien that flew over Phoenix right now, you would think the #1 franchise was space available. That's why you don't get in the retail business. It's upside down. But, and if you and going into dental office, you would have to think, well, dentists don't work. I mean, I just saw 1 million dentists, and 80% of them are sitting in a chair right now.
This is the biggest thing I talk about in my consulting work, Howard. And that is exactly that, is how inefficient they are. Look, and also the other thing is they deal with a lot of negative energy, and their leadership skill and management skills and all that other stuff. Look, the reality is this. I just explained this in a video. And I'll do it again, but look, here's what happens. If you can produce $2,000 in an hour, which is very possible, $1,500 in an hour, you don't need an associate to pay 8 hours a day for $600 to have 2 assistants and another front office. That's 2 or 3 people you added just for that person to do $3-4 grand of dentistry. Go sit down for an hour and a half, 2 hours, and cut your $3-4 grand and get rid of 3-4 employees. You have less people to manage.
And you know how many dentists have given instructions that they don't do recalls, they don't do cleanings. They would rather take a no-show and sit at their desk for an hour while a patient has to wait in line to come in to have a $40 an hour hygienist do a $60 cleaning because doc's too lazy to do a cleaning.
And that's why a doctor can do $5 or $6 million in a year. And the doctors that are always complaining and are upset and nothing is right and they're inefficient and that all this stories about them not having time are doing less than $1 million a year. This is great stuff, Howard. And I know you got limited time because you got another call coming. But this young man, 58 years old, that turned 58 on Saturday, is going to be with us at a live virtual summit. We're doing it for free, September 18th. I asked Howard what he wants to talk about. He said, I'll talk about anything. He's done this for 30 plus years and everybody knows this man. So you want to listen to what he has to say. Howard, thank you, my friend. I appreciate you. I appreciate your time. I know you're busy and I appreciate your wisdom. I hope there are young dentists listening to what we just talked about for 35 minutes and take it to heart because we've done this for a while.
Well, hey, it's an honor to be on your program, and my gosh, in dentistry, Doc, it's your game to lose. Just come on. I mean, if you're a doctor in America, you got no excuses. You know, it's easy. Just do it.
Well, I will add one quick thing to that, and I will tell you, because I've gotten in trouble financially, and a lot of that has to do with greed and other factors related to your mindset and not necessarily the actual dentistry itself. It's how you spend the money that you make. That's the key as well. This is something I talk about in my consulting as well. Howard Farran, Dr. Howard Farran, his initials were BFD, but I wanted to leave that until the end, but we were just joking about that before the call. Howard, thank you so much. I look forward to seeing you and listening to you on September 18th.
All right, I'll be there, buddy. I can't wait. Thanks for having me. It's an honor to be invited to be on your show. And tell David Hornberg hello in San Diego. Can I just say one last thing about before I go back to San Diego? I want to tell you my pet peeve with your city, San Diego, right? It was the tuna capital of the world. It caught all the tuna, processed them. It was the export tuna around the world. And then your government said, well, you didn't like the environmental impact. You didn't like this. You didn't like that. And so it had closed down. And now all those jobs went to the Polynesia, Oceania, and Asia. But did anybody in California stop eating tuna fish?
Nope.
Anyone? No.
No.
So, all your environmental bullshit is just sweeping shit under the rug, and you've regulated 50 million people out of a job making tuna fish, but you didn't quit eating the tuna fish. So you know what would have been better? If you would have regulated it in your backyard, and instead of regulating them, help them. Well, it's right there. You got University of San Diego. You got all the doctors, all the PhDs. You should have fixed the problem in San Diego, but that's not what government does. They regulate out. If they would close down OSHA, if they would close down all these stupid agencies that ran off all these jobs, and when you got a problem with the tuna fish industry, there's minds like mine and yours that could have fixed it and made it cleaner, but sweeping it off under the rug to some poor country overseas, didn't do anything for the environment, and it sure as hell was economically devastating. So whenever you do go to San Diego, before you go see you, and your website is, my gosh, seven figure, that's your YouTube. There it is. www.sevenfiguredental.com. But before, if you go out to San Diego to see the man, stop by the museum and look at what shoulda, coulda been with the tuna fish industry. That's my only rant.
Well, we appreciate the rant on tuna. We'll keep that in mind.
Okay, now I'm going to go have a date with Starkist. So
sounds great.
Have a great day, man.
Thank you, Howard. I'm Dr. Shahin Safarian, founder of Seven Figure Dental and Love Bites Dental. Come join us on Facebook, September 18th, for our live virtual summit. Have a great day.